Let us be clear, weekly COVID boosters are not happening yet. I'm doing that because this is such an unusual situation that anything is possible. The reason why I have made that reference, one, is to catch your attention, to make you realize that we are on a trajectory that no one could have quite imagined, and it's related to this piece of news, which I'll be going through shortly. Taiwan shortens COVID vaccine gap to 2 months for high risk groups. Now, I don't know about you, but I remember hearing that only 3 doses were going to be needed. We are now up to maybe number 10. And if I'm wrong, I can remember the meme in 2021 where you had a person with 7 needles stuck in them. And at that time, 7 boosters or 7 vaccines, which would be including 5 boosters on the primary dose, seemed absolutely ridiculous. We've surpassed that. So, when we heard about annual COVID vaccines, that seemed unbelievable at the time. After 3 boosters, then 4, then 5, then 6, then 7. I'm not quite sure where we're up to now. And now, then you had the breakdown to 6 months, and now 2 months. How is that scientifically explainable? That really is my concern. I mean, it's one thing to say that it works. My question is, why? Let's look first at what happened in Taiwan. And you have to understand that that part of the world now is suffering a surge from the latest COVID variant. I think it's NB181. Just remember, if it's there, and because there's still international travel, expect it to come to your corner of the woods soon, kind of like what happened with the Delta wave. And so it's worthwhile being aware of what is going on and trying to think of how different populations are likely to cope with what's going on. So here is the news. Taiwan shortens the COVID vaccine gap to 2 months for high risk groups. That's seniors, indigenous 55 to 64, and the immune suppressed. And it's based on the fact that COVID cases are surging in Taiwan. That's the first thing that you have to realize. And let me just mention something here that is really important to take into consideration. Taiwan is almost 90% vaccinated. So, what we're looking at is a very highly vaccinated region with another surge of COVID. Now, if anyone recently saw me do a presentation on Haiti, they have no COVID problem and they are only 2.7% vaccinated. Now, some people will say that's purely coincidental. I say that's an important point that needs detailed research. Something is not right. So let's get back to exactly what's happening here. So they are in response to the CDC announcing that starting June 11th, seniors age 65 and older, Indigenous people, and immunocompromised people may receive a second JN dose after 2 months due to waning protection and increased risk of severe illness. So, this is something that Taiwan has started to do based on recommendations from the CDC. I was thinking, I didn't know that the CDC had 2 monthly recommendations in their process. So, as usual, I try and get some facts. And so I've got here, this is from June 6, 2025, the interim clinical considerations for use of COVID 19 vaccines in the United States. This is from the CDC, and it's a PDF which I downloaded. I will come back to this shortly. But let's look back at what is happening, as I said, in Taiwan at the moment. So they are having a significant wave rise in terms of cases. So last week, They saw 60, almost 63,000 outpatient and emergency visits for COVID, along with 132 severe cases and 15 deaths. And they're expecting this peak to continue into June, early July, reaching up to 200,000 weekly visits. This this is pretty serious stuff. And this is kind of like what I had predicted some time ago. And it's difficult for people to understand if they're not looking at the science to understand why these predictions seem to be getting right. And it's because I understand the science. And this is what I essentially predicted. And last year I was working on it. I had some gaps, so I couldn't finish the paper. But essentially, I said that in a highly vaccinated population with recurring COVID infection, you're likely to have a COVID storm. The combination is a nightmare. And this is what I think that is happening in Taiwan and is likely to happen to any region that is highly vaccinated when it gets this latest surge of virus. Now, what it is that they were basing it on is these facts here from the CDC. And this here, the CDC cited international data showing that for seniors, protection against hospitalizations drops from 53% within 59 days to 38%, up to 60 to 120 days, and then 19% by 120 to 179 days. This is 6 months, and offers little or no protection after 180 days. Um, there's a problem here. I, I'm, I genuinely am flabbergasted that the scientific and medical community is not taking these kinds of numbers seriously. Please, if you have been hearing about vaccines, this is not normal. This is not what you get with measles, mumps, rubella. You give the vaccines early and it's lifetime protection. There is no 180 days. That to me is untenable. And I would say, I mean, I can understand people not quite getting that concern early, maybe in 2021, even in 2022, they were caught up in the narrative. They didn't understand the science and they go, okay, maybe, yeah, after three, after four, after five. But this is untenable science, meaning that something is wrong. This is not how a vaccine normally works. I would go as clearly as to say that this is operating more like a therapeutic intervention. Therapeutic meaning, imagine that you understand the mechanism of the disease and you need to give a medication every 3 to 6 months to reduce the risk of severe complications. That's more like what this sounds like. It's more like a therapeutic intervention. And if that is the case, it needs to be acknowledged, it needs to be reflected on, and it needs to be clear that this is what is being done. Additionally, and this is very important, if that is the approach as a therapeutic, then you need to think carefully as to what is the mechanism for why it works. How is it immune suppression? Is it just antibody numbers? Because it may then mean that there are cheaper, safer, better options available than just doing what we have never done before. Now, this seems as though I have to be, can you believe I have to be careful about saying this? Because this is the kind of considered misinformation I'm talking about. I can't explain what is happening now. And this, in my view, is almost a point that is so far down the line that if we don't have the scientific and medical community asking these questions, you are going to lose the trust of the public because this doesn't make scientific sense. So, my question was, where did the 2 month thing come from? Because I was surprised by that. Because if we're at 2 months already, and they say they will do this in a surge, kind of like what's happening in Taiwan. But what happens if that surge doesn't stop? Meaning that if you have another variant after that, and suppose the variants get closer together, what about 1 month? What about 3 weeks? What about 1 week? So you can see when you do that extrapolation, you realize that when I did this in 2021 and said 7 boosters seems impossible, we hit and went beyond that. So when I say weekly seems impossible, I'm not so sure that based on the current trajectory, it seems that there is not the willingness to reassess what is being done. As I say, it's like a clinical situation. After your third or fourth course of antibiotics with a patient, you have got to start thinking whether or not this is an infection. That's just good clinical approaches. You don't just give them a fifth, a sixth, a seventh dose of antibiotics. Suppose it's a fungal infection. Suppose it's a viral infection. Suppose it's inflammation. You have got to reassess based on anticipated outcomes. And as far as I can see, even for the most pro person, this can't be an anticipated outcome. So let's go back to where it came from. The interim clinical considerations for use of COVID vaccines in the United States. This is June of 2025. And what I've done here is I've done a search for 2 months. So if I start jumping through, you will see there are 82 points in this presentation where there are 2 months after multiple different doses. And I'm thinking to myself, when did this get included in the document? So I'm going to show you in a second just what I realized. And I had to do this search and try and make sense of where this was coming from. And so I have here, what you look at then is the trajectory as to what was going on over the period of time. And so when I look at previous updates here, what you see is that in October of 2024, that's the first time, well, that's where it was very clearly minimum interval of 2 months, regardless of vaccination history. And the only exception is unvaccinated people. So you can see here 2 months is occurring a few times here in terms of, certainly this is talking about the booster doses, minimum interval of 2 months. Now, the unvaccinated after the initial dose, the second dose, that may be different. But as I go down here, this is now August 2024. You can then see the previous recommendations going down to April 2024. So it seems as though this bit of information in terms of the 2 months was primarily done in October of 2024. And so what we're seeing here is an extrapolation of that guidance to our current situation. It's almost as if they anticipated that this was going to happen. And I guess they looked at the data and they realized that the immune protection fell off very, very quickly. For those who are following the science, I can tell you this makes perfect sense because for some strange reason, certainly with the mRNA vaccines, COVID vaccines, they can't get bone marrow long-term protection. So for some reason, which should be investigated, the immune system refuses to remember it. And so this is part of the reason why there needs to be recurring shots. Normally, your immune system in the bone marrow will produce new plasma cells, regenerate them so that after you've had an infection, it produces antibodies. But for some unknown reason, the immune system refuses to do this. My thought at the time was that it was treating it more like a toxin rather than an antigen, because the only other time, or not the only other time, but one of the other times where the immune system does this is with the gram-negative toxin. It refuses to make long-term immune protection against it, which is why people can have gram-negative bacterial sepsis on multiple occasions. So when we have a situation like that, where there is poor understanding about the pathophysiology in COVID, I've always said, and I still maintain, this is viral mediated autoimmunity. This is why you use steroids. This is why immunosuppressants work so well in severe COVID. To me, it seems blatantly obvious, but for those who don't quite get it, just remember that your most effective strategies are immune suppression. And so the question is, first, is it that the COVID vaccine is causing immune suppression through IgG4? I is waning exceptionally quickly. Here is the reality. I think that the people who have been and are still in charge have so gambled on one solution for this very complex, novel viral infection that is able to do things we've never seen before. They are treating it like the flu. This is not a flu. And they're getting caught out by it because the only thing they have left in their basket are more vaccines. They've thrown out everything else. That's the problem. And even with that limitation, and this is part of the reason why I am not necessarily in the crowd that says completely ban them, and it's because I do know it does some kind of immune suppression, which makes sense in terms of an autoimmune response. And if it's the only thing that people have, then it's the only thing that you can use. But there is a responsibility to now find solutions. I can't believe that after 5 years of this, there is not a clear understanding of what is triggering the cytokine storm and why it's occurring, and why is it that using a vaccine, and we're not talking about one, we're talking about multiple different platforms, adenovirus platforms, whole virus vaccines, mRNA vaccines, protein subunit vaccines, nothing has been able to stop this. At what point do you stop and say, maybe we got the pathophysiology wrong? Is it ego? Is it the fact that there is so much invested? I don't know. But sadly, based on where we are now, there is nothing left in the basket for you. So what we're dealing with here is a nightmare scenario. And even the chances of mitigation are rapidly disappearing because there is still no acknowledgement that, Houston, we have a problem. Where do we go from here? All I can tell you is do your research and try and find some simple stuff. Maybe find out what the Haitians did, because they managed only 837 COVID deaths out of 11 million people. When you look at the numbers, it was 7 in 100,000 compared to the USA 300 in 100,000. Some people say it's just because they were young. I don't think that that counts that much for such a difference in a country that had poor healthcare infrastructure. So maybe we need to find out what they did and see whether or not it can be applied to countries across the world. All I know is at this point, we need people who have got outcomes. not people who have credentials. Outcomes is what we need now. Whoever has done it, whoever has saved lives, whether it's Dr. Shetty, whether or not it's what happened in Honduras, whether it's not it's what happened in Haiti, we need the right people in charge to be able to help the population get through what is likely to be a difficult few years ahead. Thank you for listening. Have a great evening.